Great. So, as I talked about earlier, this talk will center on the different categories that we have available to us for spine fusion. I will incorporate some of my own practices, the evolution of the choices that I've made, and I'll talk about mainly, what is the best bone graft extender, and number two, what is perhaps the next best thing that we can use to replace bone morphogenetic protein. These are my pertinent disclosures because I do consult for industry partners in this area, but I'll hopefully just be talking about product categories, not actual products themselves. So it's important to keep in mind why we're talking about this, right? So spinal biologics is a big topic, but really the reason we talk about it is because of the patients that we treat. Different anatomic areas, different spine structure, we have to make choices depending on their biologic milieu as well as their capability of forming fusion. And we have many candidates. I'll talk about all of these categories and what the evidence sort of suggests for all of them. My hospital is currently undergoing the RFP process for osteobiologics, so it's important to keep in mind what different categories do and then within those categories if there are different variations. The discussion also goes beyond just efficacy. Cost is obviously a major issue when we talk about adoption on a formulary, but is it safe and how is the regulatory process managed for these products? Very important because each product will have a different type and amount of data. And then finally, the players, the surgeons are in the room, industry partners are in the room, but this goes beyond that. Academicians have formulated careers based upon this topic, as well as the hospital systems that have a keen interest in cost effectiveness.